Good day, my dear undergraduate students. We are now coming to the fag end of the RBCs, where there might be some topics which we shall miss, such as the autoimmune haemolytic anemias. Just by heart what is on the screen. They are divided into the warm antibody type and the cold antibody type. And the third one is paroxysmal cold hemoglobinuria, not nocturnal hemoglobinuria. The warm is again divided into primary and secondary, secondary having autoimmune, neoplastic, and drugs. Similarly, the cold is also divided into primary and secondary, wherein there can be infections, bacterial or viral. The basic mechanism is any of this. It can be autoimmune, alloimmune, drug-induced. And the hemolysis can be both intravascular and extravascular. Now, the basic mechanism is there is phagocytosis of the coated red cells in the spleen. That is a notorious organ for the phagocytosis, either with the FC portion or with the C3. They are coated and then they are phagocytosed. Patients are mostly of the young middle age, so it is not acquired. As a result of which, they can be having anemia, jaundice, splenomegaly. Evans syndrome is one special type of autoimmune hemolytic anemia. Look at the picture over here. In the case of autoimmune hemolytic anemias, we will be having these cells. They are all round and dark, no nucleus, no central pallor. They are the spherocytes, classical of autoimmune hemolytic anemia as well as hereditary. Hence, the age matters. And I am also finding large cells which are purplish. They are the reticulocytes or the polychromatic cells, the immediate precursors. One of the most important findings will be there is a clumping of the RBCs. Because of this antigen-antibody complex, you find that there will be a clumping of the RBCs. Once there is a clumping, there is a stasis, and there is phagocytosis, and the story goes on. The laboratory findings is it is a normocytic normochromic anemia with a good number of spherocytes. And platelets are normal but can be reduced in Evans syndrome. The test that can be done will be the direct Coombs test or the indirect Coombs test. Also, the osmotic fragility test, because the spherocytes are increased. So, there is increased osmotic fragility. Bile is also present, unconjugated hyperbilirubinemia. And specific antibodies can be found for specific diseases. The treatment will include treatment of the underlying cause, such as infection, drugs, etc. Splenectomy, corticosteroids to suppress the immunological reaction, immunosuppressive therapy in other ways, and cytotoxic therapy. These will be the modes of treatment, and please do remember it is a rare question, but we should not miss the marks. Thank you. Class 17 is over.